A mammogram is a safe and low-dose X-ray of the breast and is used as a crucial screening tool for early detection of breast cancer, often before any physical symptoms develop. And when breast cancer is detected early, the chances of successful treatment and survival increases significantly. Regular mammograms are important as they monitor changes and new developments over time, especially for those that are high risk with dense breast tissue or a history of breast cancer. So what happens during a mammogram? Once you arrive at your healthcare facility, you'll be taken to a changing area and asked to undress from the waist up and put on a gown. It is recommended not to wear deodorant, powder, or lotion on the day of the exam, as these can interfere with the imaging. You will then be guided into the mammography room and will stand in front of a mammography system. The technologist will ask you to open the front of your gown and will proceed to position your breast on the flat surface. A clear acrylic paddle will be lowered by the technologist, placing a gentle but firm pressure on your breast. Compression must be used to spread out the tissue and hold the breast very still. This will enable the technologist to obtain the clearest image possible. The compression, while sometimes uncomfortable, is necessary and only takes a few seconds. You might be asked to hold your breath for a few seconds while the X-ray is taken to avoid any movement. Typically, 2 images of each breast are taken, one from the top and one from the side. To help the radiologist see as much breast tissue as possible, women with implants typically have 4 images done on each breast. This captures the breast tissue with and without the implant in view. The exam is now complete, and the entire process from preparation to the end of the exam is very quick, usually taking about 20 minutes, with the actual compression lasting only a few seconds for each image. The images are then examined by a radiologist who looks for any abnormalities. The radiologist will provide you with your results in a letter, which will also include information on your breast tissue density. You'll typically receive results within a few days to a week. If a change or anything unusual is detected, further tests like additional mammograms, ultrasound, or MRI imaging may be ordered, or a tissue biopsy may be recommended. In the US, regular annual mammograms are recommended for women starting at age 40. However, depending on individual risk factors such as family history and genetics, your healthcare provider may recommend a mammogram before the age of 40 or additional imaging. Always consult with your healthcare provider to determine the best screening schedule for you. And remember, when breast cancer is detected early, the chance of survival increases significantly. So prioritize your health and get your annual mammogram.